Uh, Good evening, sir. Dr. Rakesh, sir, are you able to hear me?
Can you hear me now?
Yes, I can hear you.
Okay.
Sir, may I request you to please put on the background, if possible?
There's some construction going near my house, so that
Uh,
background is not in my control.
so I can guide you. You can do it. Yeah. So I had sent a virtual background on the group. I can send it to you again. Um, you can put it like when you have you joined through the app, sir, or through the browser?
I've joined through the link which was sent to me.
Yes. So do you also have the app?
No, I don't have the app.
Okay, okay. All right, sir. No issues there. No problem.
I'm sorry for that background. There's some
No,
construction
no
going
issues.
on.
No, not an issue, sir. It is not about your background, sir. So, like, we were trying for a uniform background, virtual background. So, this is also fine, sir. Not an issue.
How do you change my background?
So like, if you have the app, there is an option there to add the virtual background.
I'm not an expert at these
No
things.
issues, sir. No problem. Thank you for joining, sir. We'll start in a few
Yeah,
minutes. As
yeah,
soon as
sure.
one more panelist is left, she has joined, then we'll begin. Thank you so much.
Good evening, sir.
Good evening, good afternoon.
Good evening. So, how are you? Where are you, sir? In
I'm
Delhi or
good.
you moved away?
So good evening, Tirumagal.
Good evening, sir. How are you?
Yeah, I'm
Many
fine
years
after a
since
long
I
time.
saw you in person. Your voice
Yeah,
sounds just the same, though.
yeah.
Voice has
The
not
voice
changed.
also,
Ah,
my voice has to be changed, but it has not changed because
not changed
I
at all.
was, yeah.
Hmm. Good.
I think
So,
Dr. Girish is somewhere in the airport,
oh,
Kolkata.
okay.
No, he's joining from Kolkata airport only.
Oh, okay. Fine. Let's see. Whatever happens, should be good. So, how is the format that you have finalized, sir?
The same thing which I've sent to you. 3 rounds of
Ah,
discussion. The first
okay.
round,
Why does the video go off and on?
I don't know. It's coming.
Because mine comes on, and then after some it goes where to touch the mouse
Yeah.
pad again, and it comes. What is that?
So just like
Okay.
what we have discussed,
Ah.
the first one will be the round one will focus on core elements that make a workplace policy effective. That is components of an effective substance-free workplace policy, so
Okay.
that everybody can contribute something. The
Okay.
second round will focus on the best practices and
practices.
sustainability. So
Ah.
of course you all have got a lot of experience on that. And finally, the most important thing is key recommendations on strategic
what you
focus
want to do
areas for
from
the
now
next
on.
5 years. What can be
Okay.
done during the next 5 years? How the
Okay.
way forward?
Okay. So we start, and then you ask the first question, then you go to the second, and so
Yeah,
on.
I will
That's
like
how it's
that.
going to
The
go.
first question I will ask to all the three panelists. So then that will 5 minutes they will share. Then we'll go to the
Okay.
second question. Then to the so
Okay.
will be 3 rounds of questions will be there. I think that will be the most effective thing. And finally,
Okay, sir.
I think the joint secretary might be joining in the beginning or at the end. I don't know.
Okay.
So she will make some recommendations. I look forward for that.
Okay. Okay. Good. So we have agreed on what we are going to do. Okay. I don't like this video going off like this. Somebody's talking in Malayalam.
Myself.
So, but I heard some of the not here by somebody else whispering. He's from Kerala, Dr. Rakesh. Johnson is from Kerala, so I'm saying somebody's talking in Malayalam.
Okay.
from there.
Okay.
So
Because I am in my
after-
office now. That's the
Oh,
reason.
okay.
I was
Okay.
talking to my colleague.
Oh, okay. Okay.
Mr. Johnson, how do we increase the volume?
Your volume is very clear, sir. We can hear you loud and clear.
On the,
I'm
on
not
the
being
system
able to
itself,
hear.
I will.
Oh,
Sorry?
My voice is very loud. I have to reduce it.
Yeah.
no.
I can.
It's fine.
Okay.
You want to, sir, in your computer, look for the symbol to increase the volume.
No,
sir.
your volume also I am hearing properly, Ragesh.
Yeah, that's
You're
what
getting my
he can-
volume.
Oh,
Yeah.
yes, very clearly.
Okay.
I think everything is clear. I don't know whether mine is a bit
No.
louder.
No. It's clear.
Okay.
Both your voices are clear. It's the right level of volume. Both of you are at the same
Okay.
volume level. No.
So that's not a problem.
Yeah, not at all. Things are good. We are good. All set. So tell me, Dr. Rakesh, so you are still in Delhi or you moved away from Delhi?
Where he can go, he has to be there.
No. After AIMS, I thought he might have decided to go elsewhere. That's why I asked.
Once again, how do I'm not able to hear you all so loud and clear. Is there any
Sir,
input?
Then
your
you have to
computer
increase
volume
your
increase it, sir.
system's volume. The volume in
Sorry?
your system. You have to increase the volume in your system.
And now,
The
how do I
volume.
do that now?
Sir,
There
you're
must
in
be
a
a volume
laptop
thing
or
on the
are
right.
you in a laptop or are you in a desktop, sir?
I'm on a laptop.
Laptop. Then on the first row across, you will see some signals like the megaphone symbol or something like that. You can increase it and see.
It must be in the bottom corner, right corner.
In the bottom, one says mute, one says stop video.
In the mute, see whether somewhere volume is there. You may have to pull the button up or something.
The mute must be for this one, this particular webcast. But I think in the system itself, there is a volume thing. I think
Yes.
that should be focused. Yeah.
Sir, you do one thing, sir. Your laptop is there, no? On the keyboard, just take a photograph and send it. We'll be able to see whether the button is there or it will appear on your screen. Different laptops. What make is yours, sir? Dr. Rakesh, what make is your laptop?
Asus.
See, Joe?
Okay. Anuksha, Dr.
Okay.
Rakesh wants to make his volume bigger.
Start. Yeah.
Hello,
Yeah.
Sir,
Anusha.
when you go down, yes, ma'am.
Yeah.
Sir, when you go down to
So
the
madam will be
right
starting.
corner of
Yeah, when I
Okay.
go down,
right,
right.
Uh,
Okay, there's something. Yeah, now can you speak?
yes, hello.
You
Hello.
all-
Yeah, I mean, Anushka solved my problem.
Very good. So, Anisha, good win for you as soon as you enter. Why do you keep
thank
disappearing from the screen, girl? Suddenly you're appearing, suddenly you're going away. Stay there. Okay. So, when do we start? Where is our famous Siju?
He might
Anusha,
be
where is
somewhere
Siju?
behind the curtain.
Why should he be behind the curtain? He should be on the screen. So, this is Nakshamukt Bharat Abhiyan. Okay. How many, but this is are you trying to give a spurt to workplace programs, Anuksha, now in NISD? Is that your goal?
Ma'am, we'll be just start shortly.
Okay.
As soon as Dr. Girish has joined, and
Okay.
GS ma'am is also joining, and she will be
Okay.
addressing all of the panels.
Okay. Have you allowed the participants to join or not yet?
Yes, ma'am, our participants have joined through various
Oh,
social
then
media
you should tell me.
platforms.
No, I'd be very quiet. I can't see them on the screen.
So Dr. Girish, sir is just joining shortly. Yes, he's joined now, and GS ma'am will address us as soon as sir is here.
Good afternoon.
Good afternoon. Good afternoon.
So I welcome all the panelists today, esteemed, distinguished panelists. It's always a pleasure to see you and interact with you all and the audience who are there for a very, very interesting and very needed discussion, a much needed discussion. So, on a very positive note, a very warm welcome to all of you for this important panel discussion on the effective policies and best practices for the drug free workplace. So, this is one of this panel discussions we are having under the banner of Nasha Mukt Bharat Abhiyan, as you know, which has started in the year 2020, 15th of August. It was a call given by our Honorable Prime Minister that we should together fight the menace of substance use in the country. And as you all know, that it's a three-pronged strategy in our country. We fight it from the supply side, which the enforcement agencies do, and we fight it from the for the harm reduction, which the health department does. But universally, well accepted way of tackling this problem is how do we reduce the demand. So demand reduction has always been the focus, and more so in the very recent years, and rightly so, I feel. And as a part of encouraging this, demand reduction activities, we thought we should put it under a particular banner, moving away from the ministry or one government, one ministry, one individual, one organization approach to a completely community based approach. So that is what Nasha Mukt Bharat Abhiyan is about. So under this banner, I'm very happy to talk about, to initialize this panel discussion on how our policies should be, whether the government policies, how should they be at the central or the state level, and how should we work together, and as we work together, what are the best practices that come out of our collective efforts. And usually when we talk about substance use, we think of the educational institutions, and we think of certain social places, like public places, and various measures or slums or hotspots, so on and so forth. We think of several things where we need to put into place certain measures, but we forget the workplaces. Okay, we forget the workplaces, or maybe we don't prioritize them. We go with an assumption that workplaces are relatively safe from the substance use point of view. There is no need for anybody to be subject to, I mean, they're not vulnerable in workplaces is the general idea, which I think as experts you're aware, and as policymakers, like we want that attention to what all should be done at the workplaces, how the vulnerabilities are, and how do we handle them. So on this note, I welcome all the panelists. And as you all know, that mental health is a very integral part of the overall well-being. And as we observe the World Mental Health Day or Week, so this is one discussion which is very vital to focus on creating a safe, a very supportive and healthy environment, not only in our communities, but also in our workplaces. As this is, I think this is one of the major challenges we face, and we should be appropriately equipped to fight this. And for that, the knowledge is very important. To know about certain things is very important. Certain presumptions we have, like we know everything, or we know certain things, and our decisions are based on that from the policy making point of view. But it is always wonderful and it is very informative to listen to all the experts on this particular topic. And I welcome all the viewers who are watching us online, and there will be definite, you know very good takeaways from this panel discussions. And we have on our panel eminent experts. I would like to introduce them. uh, we have a Professor Rakesh Lal, who's the former chief of NDDTC AIMS, with us today. And we have Professor Dr. Girish Rao from the Center for Public Health, NIMHANS, Bengaluru. And we have Dr. V. Tirumagal, Master Trainer, Colombo Plan and UTC Global, Chennai. We very, affectionately know her as Tiru. I have gone through, a lot of material modules you have made. And we have the session moderated by Mr. Johnson. He's the Executive Director, National Resource Center for the NCDs. So thank you very much, and I welcome you all to this panel discussion and looking forward.
Thank you.
Over to you, Mr. Johnson.
Thank you,
Thank
Sri
you,
Radhika
Sri
Chakravarti, for your nice words and for the initiative you have taken to bring all of us together. So once again, good afternoon and welcome to the panel discussion on effective policies and best practices for a drug-free workplace. At the outset, I would like to extend my heartfelt congratulations to the Nasha Mukta Bharat Abhiyan, the Ministry of Social Justice and Empowerment, Government of India, and especially Srimati Radhika Chakravarti, Joint Secretary, Ministry of Social Justice and Empowerment, for spearheading this vital discussion on such a pertinent issue. And already mentioned by Madam, we are privileged today to be joined by three esteemed panelists who will guide our conversation and share their valuable insights. So they are very prominent persons who have done a lot of service in this field, and Professor Dr. Ragesh Lal, Professor Dr. Girishan Rao, and Dr. V. Tirumagal. So the structure of the panel discussion, which we have already shared earlier, to ensure a comprehensive and engaging dialogue, our discussion will be divided into three structured rounds. Each panelist will share their views within a 5-minute time frame during each round. I think it's clear to all. So we have sufficient time. We have 3 rounds, and we will start with the first round, the key components of an effective substance-free workplace policy. And in this round, we will focus on the core elements that make a workplace policy effective, balancing employee well-being, legal compliance, and safety. So let us begin the discussion with Professor Dr. Ragesh Lal. Over to you, dear Dr. Ragesh.
Good afternoon, Madam JS and Dr. Thiru, Dr. Johnson, and Dr. Girish. I'm happy to be part of this very, very important meeting. So the first session that Dr. Johnson has spoken about is how should this policy be effective? I mean, no matter what the policy is, it has to be effective, it has to be implemented. So I would like to say in this way that, first of all stakeholders have to be involved. That's number one. That's the most important thing. And they have to accept it, and they'll only accept it once they know the advantages of our policy. And it should not be imposed by somebody. We should not give a policy to somebody else and that you follow this thing. They have to develop the policy themselves, and they'll have different needs, different this thing. So policies will be very different. It will be different for, like, say, airlines, which has got a zero tolerance policy, or it will be difficult for the service industry. Everybody has their own needs. So they have to develop the policy themselves. And it's absolutely important that we involve the union. Without that, there is nothing, no further movement. And the impression we have that the union will always oppose. We've done this thing earlier. They do not always oppose. I mean, they are willing to listen. But the most union is only looking for that there should be no penalization. I mean, if they're happy that there are no penalization of the workers, then they're totally with us. And if they are convinced that there can be a benefit to the worker and the company, then once we get the union on our side, then we are halfway there. That is the most important thing. And once again, I'm repeating, the policy cannot be imposed. It has to be done by the company themselves, their own needs. The only bottom line in any policy is no intoxication at work. what you do without work, what you don't do without work, so long as it's not affecting the company, that's not important. But no intoxication at work. This is a bottom line for any policy, any company. So with these opening lines, Mr. Johnson, I'll hand over the mic to you.
Thank you, Dr. Rageshi, for this very important and significant comments at the earlier stage. So I think we will now listen to Professor Dr. Girish and Rao. Are you hearing? Dr. Girish?
Yeah.
Over to you.
Sorry, I'm in the airport. So please pardon me.
I know.
Communication related. Okay. I'm a public health practitioner. So when we talk about public health, I think what we are looking at is the art and the science part of it. I think most of the time we talk about the science part of it in terms of prevalence, patterns, who is affected, etc. But public health is also really looking at the art part of it, wherein how can this problem, whatever we have identified, be rolled out. Workplace, in that sense, as Liam initially said, it is, I wouldn't say neglected, but possibly because of the peculiar challenges what is faced, as Rakesh sir was mentioning, the unions come into picture, the management comes into picture, and there is also what we need to factor in when we talk about a workplace, the family members who come into picture. So it's quite a complex situation what we are looking at. Now, this is the first point what I need to flag in there. One, occupational health is a complex, and we need to be looking at it. One, it is something which is much more amenable, something which more, which can be, the intervention can be quite robust, and intervention can become much more effective also. Second part, let me put that in. A second part of the art when we are looking at public health, art and also partly sciences. One, people don't one disorder. Now, NCDs, when we talk about diabetes, when we talk about hypertension, when we talk about cancer, I think all these get bundled, and we need to be looking at it in a comprehensive manner. Now, that is where intervention will effectively work, and then we will be able to take up activities. Let me stop saying that. Thank you for this opportunity. I think Nasha Mukt Bharat Abhiyan is, in that sense, a wonderful opportunity for us to look at, revisit many of the earlier models of care, and we should be able to make implementation possible and feasible. Thank you.
Thanks, Dr. Girish. Especially from the airport, you are just joining us. That's a great thing. So now I invite Dr. V. Tirumagal to share her views.
I'm spinning off. Thank you. Good afternoon, everybody. I'm spinning off from what all three of you said. Mr. Johnson talked about how it's a balance between safety, well-being, and law. And Dr. Rakesh emphasized that it was a orchestrated effort that had to involve all the stakeholders, not just the top management, but including the union, and you had to get the union on your side. I like the choice of words that Dr. Girish used, saying it's an art and a skill to be able to bring all these stakeholders together and make some music. So keeping that in mind, I sincerely believe that good employee-based programs need to be part of the overall health package, because if I try to address substance use in isolation because of the stigma it brings, it also questions the idea of my individual choices. If I drink, what's your problem? I drink in my time with my money, etc. So instead of singling substance use alone in question, me being able to sell alcohol, awareness about alcohol use, along with hypertension and diabetes or healthy living, etc., to be part of the overall health package, sort of, it's a good selling point in a workplace. And Dr. Rakesh also emphasized the consistency on being able to stay with it, do it repeatedly, do it in a uniform way. And to do that, it's very important for a workplace to commit itself to a policy on where is their stand when it comes to substance use. No alcohol or drug use in the workplace. Okay, it needs to be said, it is written, and I know exactly what will happen if I do use alcohol or do use cannabis in the workplace? Where is your stand? Is it because once there is a written policy, it makes everybody feel safe. It gives the middle management a kind of a set standard to apply. Like suppose you see three people you suspect we are under the influence of alcohol or under the influence of cannabis. So what is your pattern? What is your thing? Are you going to send us for drug testing? Is it okay for you to ask us to take a breath test? Are you going to refer us to somebody to talk to somebody outside the organization with the assurance of confidentiality? I think organizations need to commit to a written policy so that all of us are on the same page. The reason why I'm asking for this is because there's a lot of stigma associated with it. So assuring confidentiality and assurance that we look at it as a health related problem, as a disease like any other, would be extremely important. And the fourth aspect I often talk about is that fact that we need to focus on poor job performance. If I am your worker, I'm smelling of alcohol, or you think all my colleagues are telling you through is high often, she's drunk, she has a drug problem, etc. If you can only confront me as a supervisor based on my poor job performance, on my absenteeism, on my on-the-job absenteeism, on the reduced quantity or quality of work, on the fact that I get into trouble with my colleagues, whatever. When you train your middle management to focus only on poor job performance factors and refer them for confidential assessment and guidance, that's when referral to addiction treatment actually takes weightage. But I am going back to the one which they said with which Dr. Rakesh started, like saying awareness is key. As a nation, in India, we drink a lot of alcohol. I think, as Vivek Benegal from NIMHANS said, our signature pattern is to drink 6 units of alcohol, which is double the amount that any other country people would accept. So I think any good workplace prevention program starts with a commitment to increasing awareness of alcohol and drug use across the spectrum of workers. Whether I'm your class 4 employee or whether I'm middle management, top management, all of us need facts about alcohol and drug use given in the same way that is repeatedly given. That's when you provide an environment for a good workplace program to be created. That's something which I think is important. Yes,
So can
over
we
to
go
you,
to the
Mr.
second round?
Johnson.
Yeah,
Yes.
thank you. I think we will go to the second round because we know the time constraints also. So in the second round, we will look into the best practices and sustainability in creating substance-free workplaces. Here, all the panelists will share their experiences in implementing best practices and discuss how to ensure the sustainability of such initiatives. So we got excellent work which has been done in the past. I start with Dr. Girishan Rao again. I think he's there itself. Dr. Girish, why not you share your early experience? Because I know the Karnataka State Road Transport Corporation, one of the best initiatives I heard in the earlier days. Over to you, Dr. Girish.
Thank you, Johnson. Much appreciate the focus back here. As Madam was mentioning, possibly our signature pattern of thinking is something very peculiar. It's wide across the spectrum. Plus, another complication which comes up is traditional workplaces have no more sacrosanct. I think there is a wide range of new workplaces which are coming up. Now that's the first point. Okay, since we had discussed about this, let me bring in this community intervention which was done by NIMHANS and led by our current director, Professor Pratima Murthy, in terms of looking at what happened in the Road Transport Corporation, the Karnataka State Road Transport Corporation. Slightly dated, but the lessons learned is still valid. Lessons learned is valid because we were able to effectively make an intervention. We were able to effectively make an intervention at the individual level, wherein the persons using alcohol not just reported reduction in usage, the family members also reported a better individual, and also the money saved from that was very helpful to them. Lesser adverse events within the family, and more importantly, the reason that and getting the management into it, the KSRTC found it to be become more profitable. I think this is music to the ears. Uh,
Yes.
Now, this is sort of a landmark study which looked at, and we just showcase that yes, it is possible. It is possible that we make it into a meaningful package. Now, that is where I would like to look at what would be things when we have been looking at integrating uh, substance use or preventing substance use, bringing about awareness as part of the screening brief intervention model. SBIRT model needs to be sort of becoming part and parcel of our clinical uh, armamentarium, so that uh, in fact, currently we are doing a national level workshop looking at motivational interview. Uh, Even when you are asking about alcohol or alcohol use, now there needs to be a strategy in which how things needs to be progressed. Let me go back to the point what was raised earlier. The time we just stop asking whether alcohol use or not, which will not be helpful at all in an incident. What we need to be looking at is develop a model, develop a working manual, and also cut across beyond the classical workplaces. I will just stop here for this round, and then we can take up what will come out in the future as recommendation. Over to you. Back to you, George.
Yeah, thanks, Dr. Girish, for that comment. I think Dr. Thirumagal can add a lot because I understand the old EAP, Employees Assistance Program, a long back, where
Yeah.
TTK and ILO were all involved. From that day, I was hearing a lot of things there. So we'd like to hear
Yes.
your experiences.
Yes, when NUMANS implemented the program KSRTC, the same kind of ILO model was done with one of the biggest publishing houses located in Chennai and a huge manufacturing unit in the outskirts of the city. With both of this, the best practices we found was what Dr. Rakesh emphasized as the up-down approach. I think the first meeting, the union top leader is a well-known guy. You can see posters in his name. The first awareness meeting for workers, the union leader came and sat on the first row and listened to the whole thing. By just his presence says, I'm backing this model up. And when the management was there, the top guys in the management, the owners of the publishing house were there in the program saying, we get you. We are talking about what is safe drinking. We are talking about unsafe drinking. We recognize the need for screening, and we're going to support intervention related to that. That kind of creating visibility for your policy, visibility for the efforts you're going to make is extremely important. I want to underline and re-emphasize what Dr. Girish said. When you talk about Dr. Girish, I always remember the wonderful work he did about the cost of alcohol use in our country. Talking about how a workplace prevention program can benefit the workplace in terms of its profitability is a selling point for this program. In a typical workplace, I get somebody, I train somebody, and then they develop alcohol or drug related problems. It's very easy for me to ask them to leave. But when I send somebody off, I'm sending out years of expertise that they've built in my organization. The cost of hiring somebody, retraining somebody is very high. So talking about how a worker with alcohol drug use problem can be a drain, and how if you keep alcohol problems out, he can become an extremely efficient worker. That selling point with related to in terms of money, I think is part of the best practices. The third component for me, it is not based on fear. If I need help, I should be able to reach out. Fear often kills a workplace prevention program because people won't seek help. In the program that we did, actually, after 1 year, the program ended. They saw a lot of self-referrals. Initial referrals for treatment came because I know that he's smelling of alcohol, he's having a severe alcohol problem. But later, when he said, I have a problem, can you foot the bill for addiction treatment? They said, are you sure it's so high you need treatment? The understanding and insight that the program has built was the best impact of the program. I think being able to have a fact-driven, non-fear based, confidentiality, inclusive approach, that's what is going to make a program, a workplace prevention program, one of the best that you can run in your city. Thank you. Over to you, Dr. Mr. Johnson. I can't hear you.
You're muted.
Yeah, that was your, that's nice experience you have shared. I think Dr. Nagesh Lal will enter this round with his experience.
Yeah, I mean, as far as sustainability is concerned, I'll pick out 3 words from Dr. Thiru. One is this cannot be done in isolation. The second is that everybody should be aware of the consequences. It should be a written policy. And once we have that in line, it should be acceptable. Obviously, if the policy is made by them, the people themselves, it would be acceptable. And first step would be, when we do any program, is to know the extent of the problem. This can be done by focused discussion, which would just be a impressionistic thing, or we could do a survey. Having done that, we have to know the infrastructure, because what we can do is, there's no point having a camp for 1 week or something and an apostrophe is treating the patient.
Yes.
I mean, you don't treat a patient in 1 week and then say thank you and go off. This has to be a long-term process. And so the important point is know the infrastructure available and train those people. The company, the institution has to look after their own people. We will be there as backup. We'll be there as help. We'll be there. There'll be some institutions where some problematic cases can be referred. But ultimately, you have to look after your own people. We can train you. We cannot come and treat your patients. That's not what Ministry of Social Justice will do. Nobody can do it. I mean, there's not a question of that kind. So the treatment should be available. It should be accessible. So obviously, if it is in your own infrastructure, it would be accessible. And it goes without saying that it should be affordable, because when we see a cost effectiveness analysis, even if you treat these patients free, it is very cost beneficial. The amount of harm he can do by, say, absenteeism or fighting or his own health, I mean, there's so many other harms which can do, that is taken care of. And the most important thing, repeatedly we all keep saying, is awareness. There's such a facility does exist, it is available, and I keep repeating that there will be no penalization. I mean, that fear should not be there. If you scare a person away, he will not come to you. That doesn't mean he's left the alcohol. He's just not coming to you. So we should pull him out. We should get him out for services, and then maybe have a group discussion amongst the past users. I mean, I'm talking about a very long-term thing. This has to be a stepwise process. It's not that we just go and start a workplace intervention. It does not happen like that. It has to be in a very gradual, stepwise pattern of work. And okay, I mean, that's what I have to say right now, Mr. Johnson.
Okay, Nageshri. So we have heard about from 3 experts on different experiences, and not are there to left because of the time constraint, we could not add more. So now we have to go to the last round, the 3rd round. We are looking into the recommendations for the future. This is a very important part, because we have to explore key recommendations and strategic focus areas for the next 5 years or 3 years or something like that, laying the groundwork for a stronger substance-free work environment in the country. And for this, your valuable recommendations can make a lot of difference. Again, I will start with Dr. Nagesh Lal. Is it okay with you?
Yeah, I mean, it's fine. I mean, I'll just repeat the same thing, that there should be awareness, there should be availability, there should be accessibility. And then once we go there, we should, for a long-term thing, we have to give them alternatives. Like, I know that when I was working for a long time in Northeast, I don't know if you've all gone there, but in the winters, it becomes totally dark by 2 or 3 o'clock in the afternoon. and people go home, and there are no cinemas, no other alternatives. So people, and you can't travel because it's so dark. So you are at home with nothing to do. Obviously, that's a recipe for taking alcohol. So some kind of alternatives have to be given, that if you do not take alcohol, what is the alternative? And we can't go say that you go out and play because it's so dark. So I mean, that has to be very, very structured individual thing. I'm talking about Northeast because I worked in that Northeast area. So that's what we've been doing. And then once again, I repeat that the company has to look after its own people. We have to train the doctors there, train the medical health professional there, and be available for backup, because that facility has to be given within the company themselves. And I'm surprised that a slightly bigger company, everybody has got a health structure. I mean, some people have even got a hospital, some people have got clinics. There are a lot of such available things. So that work has to be done, that see the extent of the problem, see the available infrastructure, and go and train them. Once again, no camps. Thank you.
Yes, that's a lot of good things, good recommendations come from your part. So now over to Dr. Girish. Dr. Girish,
Okay.
yeah,
Thank you,
looking
Johnson.
forward for a few recommendations from your part.
Okay. Well, at a principle level, I think I was quite excited and thrilled to look at what is coming out very clearly in the last half an hour. One, it is to be a medical model. It is like any other disorder which we should be looking at. Second one, it should be a public health model. That is, we need to be looking at it as a integrated approach rather than in a individual. Just looking at alcohol will not be helpful. I think that's being told time and again. That integration is what we need. Third, interestingly, what Rakesh sir brought out is alcohol as a recreation. Now, alcohol use as a recreation. I think that's a larger agenda which the country needs to be looked at. Because when we look at what is happening to the elderly, loneliness is becoming a problem. What are the alternatives to lifestyle living which comes up is not just for one section of the population, but across. So I would put that as a social model which needs to become. Keeping these three principles in mind, my recommendation is let's look at 10 workplaces which across the country and develop models, workable models, and then see what could be more generalized and could become sort of a national program. Which it should have several elements. One is SBIRT as the first level, and then second level is in terms of the larger management of the complications, and third level is this tertiary activities in terms of managing those with severe addiction. Now, this is where I would like to again bring back the public health point of view. We should not get trapped with looking at only the addiction part of it, but also the sub when they get to get into that full way of alcohol. I think we forget that part of it. It is only when people have crossed that limit of pathology is what we look at. I'm sorry, that cannot be. That is only looking at the tip of the iceberg. We need to look at much below that middle part of the pyramid, which is really those who are at risk, who should be concentrated on. We don't. Now, through this opportunity, let's create 10 such models across the country so that we just don't look at only the top end or the tip of the iceberg, but the huge group who are at risk. Now, that is where something meaningful can happen, something scalable can be demonstrated. And again, as Madam was mentioning, Madam was mentioning, it will be music to the ears of people who are at the financial sector. I think showing that money is gain, or it is really helpful from a finance point of view, would carry more weightage for implementation. Let me stop at that and then look forward to what will happen.
Yeah, thanks, Dr. Girish, for that very important points which you have mentioned. Now over to Dr. Thirumal.
I recognize Ministry of Social Justice and Empowerment have a network of more than 500 free addiction treatment service providers. Your government invests a lot in their training. It's part of your budget. Already investment is being made. I would like to see IRCAs engage with workplaces, trying to offer spurt services, screening, brief intervention, and referral to treatment. We know roughly in any community, only 3 to 7% will have addiction per se, in the sense there is physiological dependence and they need a full scale addiction treatment program. Many, in India, we have a large abstinent population. Around last NFHS related to alcohol says that about 80 to 80% of men are not using alcohol. So you're talking about a large population that roughly about 50, let's say in Tamil Nadu, it's about 40% of men use alcohol. So we're talking about a large non-alcohol using population. In our awareness program, we should tell them, great job, man. You're not drinking, stay that way. There is a small group who are using alcohol on and off or using it in hazardous ways. We should be offering spurt, and your IRCAs can be very easily trained to provide screening and brief intervention services to those clientele. And with the fact that we have a large informal sector, about 10 crore of informal workers we have. So we should be able to make it available through the IRCAs. I think the other well-established formal sectors, I think we should explore the idea of offering them EAP services, employee assistance program services, using the internet so that they can access these services under the in confidentiality in their own space and time, to provide, to get help for their issues, go through a screening and get help if needed for their alcohol program. I think the government's resources can be sort of channeled very easily with little amount of training into this area. Yes.
So,
Yes, Mr.
yeah,
Johnson.
so a lot of, during this, what you call 45 minutes, we have come across many areas. So something to add? Anybody would like to add something here before going to the concluding part? Girish, Nageshji or Thirumagal, anybody?
Oh,
I like the
sorry,
idea that Dr. Girish talked about. Go ahead, sir. Go ahead, sir.
No.
You were talking
I
about,
did not think the
talking about social
question
issues.
was
I
to
like
me.
that. Yes,
Yeah.
it was to
No,
everybody,
yes,
sir.
carry on,
I
sir.
would just like to reiterate what you said, madam. One, the abstinent population is what we need to focus on, number one. Second, more importantly, those who are at risk, those who have started just now, who are already having some physical impact, gastritis, sleeplessness. Now, these are supposed to not get linked at all when we talk about alcohol use. And that is where possibly the larger effort should go in. And that's a very good opportunity at the workplace. Because when they come to the clinic in the occupational space, occupational health center, now making a deliberate link with respect to a medical condition, what they have, and linking it up to many of these substance use is something which is missing in a very big way. That's sort of the larger blind spot what we are having in this entire effort. The second point I just like to reiterate, the addiction treatment facilities which has come up across the country. Now, rather than restrict only to the hospital base, probably reach out to the nearby occupational facilities which are there. Could be a good extension activity which could happen. Plus, that would also make it much more strengthening the ongoing program. Well, I'll stop here. I just intervened because I didn't think the question was to me, but it was to the larger people who are listening. That's it. Thank you.
You want to add something, Thirumagal?
No, I was just wanting to emphasize what Girish had said, that the social issues, that sort of an important part it plays, and your workplace prevention, group-based programs will attack just that. Like in our program, when we continuously talked about 6 units of alcohol, etc., it changed the way the workers looked at alcohol use. Like previously, any celebration was, I buy alcohol for you, both of us go and get drunk. Now, after this awareness program, they say, alcohol, maybe not. Let's do something else. So the sort of the peer pressure was now employed in a very different way. So your workplace prevention programs have a powerful role. They can change the attitudes of people, the way they look at cannabis or alcohol use. So your workplace prevention programs benefits have a ripple effect. It can have a positive impact on the community because they go home to their families, they talk about it, they send the message to other members who are not employees. So I think spending some effort in this workplace prevention program would make sense in every way, socially, economically, in terms of profitability of the organization, etc. That's it.
So I think it's time for us to conclude if there is no other comments from any of the panelists. So as we conclude this meaningful and enlightening discussion, I would like to extend our deepest gratitude to our distinguished panelists, Dr. Girish, Dr. Ragesh, Dr. Thirumagal, for their insightful contributions. The task ahead of us is very significant, translating the valuable suggestions and recommendations from today's dialogue into actionable steps. I am confident that the Ministry of Social Justice and Empowerment will continue to foster collaboration with key stakeholders to develop and implement an effective substance-free workplace policy for the nation. Before we close, I would once again like to acknowledge the tremendous efforts of the Nasha Mukta Bharat Abhiyan, the Ministry of Social Justice and Empowerment, the Joint Secretary Srimati Radhika Chakravarti, and our exceptional NABH team for organizing this impactful event. Thank you all for your participation. Once again, thank you. I think with this, we'll end up this wonderful, panel discussion. Jai Hind.
Yeah, I'll just take one moment, Dr.
Great.
Johnson. Yeah, thank you all so
Great.
much because I can't miss the opportunity of thanking you all. Very important discussion which happened today, and several insights. We have very rightly pointed that the importance of what we say, that is anyway there, but the manner in which we say is very, very important, because it's ultimately everything comes down to a human to another human. So I think that's the thing, and several recommendations have come. We would definitely take all of them into consideration, examine them, and then see how we can improve the policies and how we can make them very focused and very strategic. And in this journey, and I'm sure that all of you are with us, with the department, with me and with my team which works for this cause, and at every juncture we are hopeful to receive your cooperation and your support in this very tough and yet very important journey. So thank you all so much. Thank you all the panelists. Thank you the viewers for having this wonderful discussion.
Okay, thank you so
Thank you.
much.
Thank you.
Thank you very much.
Thank you.